Hello, everyone. Welcome to this one more fresh episode of Life in Progress Personal and Professional Stories. Our today's episode is little different. Our today's guest is she's a homeopathic physician, but homeopathy for many years we are considering this particular stream of treatment and therapeutic regime, as in when we have to wait for something or we want the complete cure of any particular ailment or any particular disease, and we are not in hurry, we do not want any instant relief from anything, any problem, then only we are approaching to this homeopathic treatments. But today our guest, she will just demystify all these myths which are revolving around this homeopathic stream of medication. And the interesting part is that when she is treating her patient, she is not only considering the physical aspects of the human well-being, rather she is considering the holistic approach wherein she incorporates all the domains, the physical, mental, emotional, and other domains as well. So I'll not kill your excitement to listen and watch this episode. Watch this episode till the end because you're gonna get a lot of insight about this beautiful branch of medicine that is the homeopathy. So let's welcome our today's guest, Dr. Tanuja. So, hello everyone. As I was telling you that our today's guest is different. She is a homeopathic physician, and yes, I was looking forward to listen to her for a long time. And today I could catch up her time today because most of the time she keeps occupied with her patients, with her clients. So, Tanuja, first of all, thank you so much that you could find the time today for all of us. And before we discuss and before we dive deep into the science of this homeopathy, I would just ask you to give your brief introduction to everyone. And when you are introducing yourself, I'm very keen to know that was you passionate since beginning to take homeopathy as your mainstream? Means how did you land up to homeopathy? I'm very curious to know all these things.
Very interesting. I'm Dr. Tanuja Rodrigues from Pune, consulting homeopath. To tell you, Meda, very honestly, if you would have asked me this question maybe few years back, I would have told you it was by default. It was not my choice. I may have secured less and could not secure somewhere else. So homeopathy was a choice that time. But
Oh,
today, I would say with the conviction and by heart that I was destined to be a homeopath, and those were the experiences I was going through and to understand more about homeopathy. So, after completing my graduation, almost for 7 to 8 years, I was working in other fields than homeopathy, the
okay.
clinical experiences. And I was not much, of passionate about homeopathy, but few instances, few experiences in my own life and in my own journey happened so much that what the thing I was running away and I was not so much curious about it. I encountered such experiences that I'll share my experiences as well.
Yes, I
So
want
the
to know
first
it.
thing was, yeah. So it is very interesting when I was working in other fields, and when it was my own experience, I'll say I had a PCOD. So I was not much believe in homeopathy. So I was taking a allopathy. So it has started from there, and then I was too much into this. When it was coming on your health, and there was no solution for this. So I said I want to see homeopathy now. My own science I was trying. I was myself was, going to experience with that. And I saw that with that, I had my all the sign and symptoms of those PCOD got cured. I got better. That was one instance, which has made me to think, I have such an opportunity to understand and learn this beautiful science where you have no answers for so many issues, and we have answer for this. Then another thing, another incident in my life when my child was suffering from chronic allergic bronchitis. That time I, after 1 2 years, he used to get acute attacks anytime, anywhere. And how wonderfully homeopathy has cured him, recovered him uh, from this. And I could, that time I was knowing homeopathy much better, so I could understand how emotions are affecting him. He's not expressive child. So I used to explain him how emotions are important, and if you do not express it, or so how it is affecting your body. So even he was getting aware because of my explaining to him, and he's much better and wonderfully got cured with homeopathy. That
Okay.
time I was just practicing only, having these experiences in my own family. So even my husband, he had hormonal issues. He was having not very to the extent, it was just started. Like, and when it comes to your family, you get so panic, like you want that solution and in a right way, you know. So even with homeopathy, his hormonal balances like sugar level were borderline, thyroid was borderline, cholesterol was borderline. So without any other medication, homeopathy, and till today he's off not on any medication, maybe since 18 years, and it was not for long term. He must have taken 1 or 2 years of homeopathic treatment,
Wonderful.
is much better. So
Ye-
after that, I realized I have this, the magic science where I should explore more, I should practice more, and that was my turning point. I literally resigned from my job. I said, I don't know what am I that time I was doing in a allopathy corporate jobs. So I resigned that one fine day, decided I don't want to do this. I want to explore. I want to practice homeopathy, know more about homeopathy, relearn my homeopathy and science. And then I joined again the advanced courses in homeopathy institutes. I started learning a lot of certification. All the senior faculties, I started gaining experiences. All workshop I used to attend, and I started practicing. So this
Wonderful.
experience is what I experience in my own family, I can see in my patient as well. So it was making me more inclined towards this to know more about it. So my belief system has become more stronger कि
True.
यही करना है, अब तो यही करना है.
Very, very
So
interesting
that
story.
was my journey. Yes.
Undoubted.
So
That
from non-believing, yes, yes, it is. So now it is only the homeopathy where I want to work. And
so,
I can see
Tanisha,
this results in everyday practice. So it is so wonderful to see the transformation in patient as well.
hmm, I can understand. Because when you are seeing result in your home only, then you are so much connected with that power of that therapy, and you are, it's not that you are telling
Yes,
to someone else, you are experiencing in your own life, and then it
yes,
becomes
yes.
easier to tell to someone else. Yes, true, I can correlate with it very easily.
And with each experiences, it evolves you as well. I mean, it evolves me as well. When I treat
Wonderful.
patient, so the growth happens in me also.
That's wonderful. Tanuja, no doubt you have seen tremendous improvement in yourself, in your family by using that specific remedy. But now I just want to go towards a little deeper into that discussion. When we are talking about homeopathic medicines, so what, because you are practicing that science for the longer duration. So what is the science behind when it comes to homeopathic medicines? Because I do not know much about. I've just seen that sweetness in their homeopathic medicine, and doctor is giving us that small white tablets, and we used to eat that. But I just want to understand what is the science behind this homeopathic medicine, and if I compare it with the conventional methods of treatment, or maybe if I compare it with the chemical method of treatment, which I am calling it a allopathic medicines.
Homeopathic medicine is completely a natural sources,
Okay.
plant sources, mineral sources which are present in nature. So
Okay.
the plant sources, mineral sources, some animal sources, some part of the animals like the milk or the venom of the animals are also used for the preparation of homeopathic
Really?
medicine. So all the, yes. So and uh, the method by which the homeopathic medicine are prepared is a dilution. The more diluted the medicine, what
Mm-hmm.
we call it as drug dynamization. The more the diluted medicine, the more powerful it is. So in
Okay.
crude form, they have many toxic or chemical properties which get eliminated when you do more dilution, more dynamization, and the medicinal properties get enhanced. That is a
Tanuja, can
basic
you?
principle behind it.
Yes, I'm just interrupting you. Can you just explain this word dynamization?
Yes.
Because dilution everybody is understanding, but what is this dynamization?
Yes, dynamization, I'll tell you. So the medicine, how we are prepared, like if one part of the substance, we are taking the source substance, 99 part will be the water. We get
Okay.
diluted by the vigorous succussion. That becomes your one potency. So
Okay.
out of that 100 part, we take again the one part and 99 part of the water, that is a two potency. And the potencies, that is how it is get prepared. So 30 potency, 200 potency, 1000, and 50,000. We have all the potency. So imagine how much drug substance. After 30 potency, you cannot see the material substance under microscope. So
Oh.
only the properties you can see it. So there is no substance you can see it. So that is a dynamic. That is something, the power is present, the medicinal properties are present, the dynamic power of that medicinal properties are present, but not the substance is present. So
Oh.
it is a dynamic.
Mm-hmm.
And yes, and why we use dynamic medicine? Because the principle of homeopathy is that a the human body, the in healthy body, there is a vital force or the life force
Hmm.
which keeps you in the healthier state. So any disturbance into this force at any level, mental, physical, emotional level, it
Hmm.
causes the disease state. So when this
Tanuja,
force
when
is
you are
dynamic,
saying,
which
yeah, when you are telling vital forces or the life forces in the spiritual context, can I just understand in the life chakras or the seven chakras or the energy system of the body?
energy system of the body,
Okay,
you
got it.
name it anything, but then all the synchronization of your body, there is some force which is present, which is, there is all synchrony is happening. So
Okay.
any disturbance into this force which causes the disease state.
Hmm.
And to heal and to cure this state, we need a dynamic force, we need a dynamic medicine.
Oh,
So homeopathy believes in body's own immune system, you can say, and we just have to stimulate it. We don't have to, body has its own intelligence to treat
hmm.
itself.
Hmm.
You just need that external stimulus to enhance your own vital force, so
Hmm.
it comes back to the health again.
Okay. So if I can understand what you are explaining, there is one side a chemical method of treatment wherein I am suppressing certain energy forces inside the body. On the other side, I am having one specific way of treatment in which we are just stimulating that energy forces inside the body. So, is that the basic
Yes,
difference in these two?
yes, the holistic healing. Yes.
Okay, that's interesting. That's wonderful. Okay,
And
yeah.
yes, 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 please.
When you are using this term holistic healing and you are explaining that homeopathy play a part in that by stimulating our immune system, so can you just elaborate this term more for everyone, that what does it mean that homeopathy takes up the part or takes up the approach of holistic healing? What does this term everyone can understand?
In simple way, the holistic healing is your mental, emotional, spiritual, physical,
Mm-hmm.
all this well-being, and there is an interconnection between all these axes. That is a holistic healing. So
Okay.
when you heal a person, all the levels needs to be in a center. That is what is a holistic healing.
Again, I'm
And in
interrupting you.
homeopathy, we also.
Yes, again, I'm
Yes,
interrupting
please.
you. When you are telling, I'm getting so many questions. When you are telling the all the aspects we need to incorporate in homeopathic medicine, so can you just throw a light that how homeopathy is connecting my physical well-being, is connecting with my emotional, means I am taking, for example, I am taking medicine and I am so much irritated. I am so much angry. So will the efficacy of that medicine will be reduced? Will it not affect me in the same way as it has to be affected? What is this whole magic behind that?
It is like the very simple way the homeopathic medicine works on psycho-neuro-endocrinal axis. Like your mind, your neural connections affects your hormones and then your physical body.
Okay.
So the treatment, it starts with your mind. Anything, most of the diseases, if you see, it starts with your mind, and then it affects your all neural connections and then your hormonal systems, and this axis what we need to treat it. So we have to understand person as a whole,
Okay.
from all his stress point or his emotional stress, from we take a case history from childhood till the date, what are the events happen in his life, what are the stress factor, how he reacted to each event, what is a repeated pattern in that person, then how he compensate that situation. There is a compensation mechanism also in a human being, you know. After action there is a reaction, then there is a compensation, some suppresses, some expresses. So
Hmm.
we have to consider each and everything, and then we that is a whole case history, then how it has affected him physically. So it starts from a mind and it goes to the where it has the his and we find out that pattern in that person. What is a repeated pattern he is expressing from childhood in those stressful event, and how he reacts to that. So we connect these dots and we understand as a person as a whole,
Okay.
how, what are his temperament, what are his tendencies, what are his action reaction, how he expresses, and then that drug picture we match it with the sorry, the person's picture, that case history we match with the drug picture. And there is a law like law of similars. When these two pictures matches, that is how we prescribe the medicine. And the law of similar is like yours likes, means the medicinal properties, like what it um, produces the sign and symptom in healthy person cures in a diseased person. That is a law of similars. That is a
Hmm.
basic law of homeopathy. And then we match according, and there are many non-verbal sign and symptom, even that we have to consider. So the case taking itself is a big procedure to understand that whole person, and
Got
that
it.
is how we prescribe the medicine. So that is why it is a holistic. It is not that it is a disease diagnosis and we just prescribe on that.
Hmm.
From where it started, because there has to be some reason to see this effect. So
Okay.
cause and effect,
Hmm.
it's always has to be there. So we try to find out a cause and
Hmm.
we treat the cause, so effect automatically will get better.
It means I can understand in this way that you are not doing, means a homeopathic stream, it's not doing any symptomatic treatment, rather than it is reaching to
No,
the
no,
origin of the problem, and that
there is,
origin,
yes,
exactly, that origin could be
and that is
psychological.
how yes, yes. And even in the acute, there is no standardized treatment. If if you say the person comes with two, three people are coming with a fever, but the expression of fever is different for each person. So the medicine will be differ in acutes also. If it is a
Oh.
chronic, of course, it is a deep case taking, yes. So how you express it, and that is how we take the symptom, and what is that uncommon symptom which is not the part of that disease picture. That is the most important for us to understand, that something individualize him as a
Mhm.
person, and then we prescribe on that.
Wonderful. That's really a beautiful science which you are explaining today. Because many times the people are having this perception with the homeopathic treatments that If you want the instant relief, then do not go for this medication. And if you have a
No,
patience, then only go for this medication. That's a common thing we listen with everyone.
it is not that. In acutes also, it is wonderful. You can see lot of benefit in acute diseases also, in chronic also. Uh, yes.
Okay, so Tanuja, when you are explaining in acute cases or in chronic cases, so because I believe the people who are listening, everybody won't be able to connect with these words. So I just want to ask you specifically that what kinds of diseases or what types of diseases can be addressed by using this treatment option? And one more thing I want to ask, is it necessary that homeopathic is always therapeutic, or it can be a preventive mode of treatment as well?
Okay. Uh, well, in acute diseases like the cold, cough, fever,
Mm,
your diarrhea, dysentery, then in acute, even in renal colics, if it is an acute phase. In the chronic diseases, there are many chronic diseases when the acute exaggeration of that phase of the chronic diseases, it works.
mm,
The GI disorders like acidity, constipation, piles, fissure, even renal stones, gallstones, it works wonderfully. Skin allergies, respiratory allergies, these are the common patients I see every day. Then even hormonal changes like PCOD, thyroid, they are the major diabetes,
oh,
hypertension. This is the common and the very large pool of patients.
mhm.
Then autoimmune disorders like rheumatoid arthritis, cancer, these are also get benefited with homeopathy
Oh,
wonderfully. So these
mm,
are the common patients usually I see in my everyday practice. Though there are many, maybe I'm may not able to diagnose it right now.
true.
Autoimmune disorders, yes. Skin, especially the skin, leukoderma, vitiligo, even those patients, psoriasis, eczema. So these are where the homeopathy really helps and works wonderfully. Because of this basic principle, autoimmune is where you have to treat the whole person. It starts with that axis, which is very important to understand.
True.
Because autoimmune, you have to understand your immunity.
True.
I'll give you a few examples, like, here about, since I'm discussing about the kind of patient, about the patient, few of my patient in acute and in chronic, how holistic healing and homeopathy helped in them.
Oh.
So the one patient who has come directly from a hospital to my clinic for
Mm,
the recurrent renal stones, she had been operated for two times before, and third time she was admitted. It was both the kidneys were having a stone, and she was like, I do not want to undergo surgeries. She came to my clinic. Can you do something about it?
mm,
That was an emergency situation. She's coming directly from the hospital with all those saline, this, and it is so in that acute phase also, the first thing comes that we can relieve the pain with the specific medicine. And the next day I called her for the detailed case history, because it needs a time to take that history. And in that time she was not able to sit for a longer time, but she wanted that relief, and she didn't want to get operated. So
mm.
next day her pain was much better. She was able to sit, and after the detailed case history, what I told you, to understand that person pattern and everything. So I prescribed the medicine, and within 2 months, her stones were out, flushed
Wow.
out from her system. And after that, the magic is that the tendency has gone to formation of stone, because that is also very important. It is not just the flushing out of the stone, but that tendency to form that stone is also important to reduce. So I
Tanuja,
think
one
since two
one
years,
intervention
she's
I will, yeah, one intervention I will do here. If your privacy policies allows you to discuss that point, then only you can discuss this point. When you are telling that the tendency of reoccurrence of the stones reduced, so what did you find? Was it physiological or psychological?
Psychological. It
Oh,
was
really?
psychological. Yes,
Oh.
yes. It starts most of the changes in your body. Yes, lifestyle factors are there. It's not that, the sleep, eating, doing exercises, there is a lack of sleep and the stress level, but the stress is a major factor. And all these other factor contribute to that to get more this thing. But in most of these cases, when there is a tendency formation, recurrent tendency formation, it is not just the lifestyle, but the stress factor, the mind factor plays an important role
Wonderful, wonderful.
to treat these tendencies.
Hmm.
So since 2, 3 years, she is off medicine and she is living a healthy life.
That's pretty
Then
nice.
another interesting case I will share. So one patient had come with, sometimes I get amazed, ki, wow, how this is happening. We give medicine with the intention to make a better of that person, to heal that person. But when
Hmm.
you see this effect, you yourself get so amazed.
Yes.
Then another patient was there who had come to me for rheumatoid arthritis, and he was firm believer of homeopathy. That's the one thing. So I did not have to convince him कि homeopathy से होगा या
Hmm.
something. I have to explain more about homeopathy because he was a believer कि मुझे homeopathy से ठीक होना है. I said good. That was a good point to start.
Hmm.
And then rheumatoid arthritis is again an autoimmune.
Hmm.
If you see, autoimmune means when you do not find any reason in conventional medicine, we label it as autoimmune.
Autoimmune.
But there is always a intangible reasons that needs to be explored.
Hmm.
So while taking the case, there was a lot of tragedy in his personal life that has led him into a disease. I can't uh, it was like, in a small, I will just tell, like, incidents like his when we were trying to find out, I was trying to find out a cause कि इतना डीप पैथोलॉजी कैसे हुआ है रूमेटॉइड arthritis. When I was trying to find out a reason, I understood the point, like his daughter had done suicide some maybe a 6 month back, or 6 or 7 months back. And after that, that anger, that guilt, I could not take care of my daughter. So that was constant, that anger कि किसने किया है, किसकी वजह से हुआ है, मुझे revenge लेना है. That anger was there and the guilt was there. So we have to consider, if that guilt and anger is there for months together, day and night, it is going to affect your body. So there is no direct pathology I can explain it here कि
Hmm.
ये हुआ तो ऐसे blood में changes हुआ and that's why it has happened.
True.
So but this is how it started,
Hmm.
and then he has landed up into this deep pathology. And after giving that medicine for that reason, for that cause, he is so better. I'm telling you. Sometimes even I couldn't believe, like, he did not started with any allopathy. With homeopathy, he's so better. Even now, he's not taking homeopathy. He's so much better. And it's not only the disease got better, he has come out of that guilt and that anger, and he is actually doing so better in his life for his family. uh, he started doing better, he started earning,
Wonderful.
started working. So he started doing all better things and uplifting things in his life. So it is not just the disease, but even their lives get improved.
Now I understand why you
So
call it
yes,
holistic healing.
yes, yes,
Now
yes.
I can understand. Okay.
So
Yes.
one more thing I want to say.
Yes.
So why then when I say you that there are non-verbal communications,
Hmm.
what does it mean? Just an example. So a boy comes to me with he had a palm. There is a lot of skin shedding on the palms, and it was there since 7, 8 years. And he had taken all the treatment from skin specialist, dermat, but nothing was getting better since child.
Hmm.
And his age was 10 to 11 years of the child. And since 2 or 3 years of his age, he was having this peeling of both the palms, and nothing, no diagnosis was able to make you why this is happening.
Hmm.
Only the palms. And when he was coming to me, he said कि 8-10 साल से तो ट्रीटमेंट ले रहे हैं, but nothing is happening.
Oh.
होम्योपैथी देख लेते, क्या कर सकते हैं, ऐसे, they
Hmm.
it becomes a choice, last choice for somebody कि कुछ नहीं हो रहा है
चलो
तो
ये भी
देख
देख
ही
लेते हैं.
लेते हैं. So when you do this detailed case, when I was taking a case, I was trying to understand him as a, हाँ ये भी देख लेते. So I was seeing that he constantly playing a music on my table. So that becomes something unique. Like no child comes and start playing with his fingers. So I was understanding, to then I started exploring कि ये ऐसे ही सब जगह बजाता है क्या. तो हाँ, ये जहाँ पे भी आपको कुछ बेंच दिखेगा वहां पे तबला बजाना शुरू कर देता है. सो दैट वाज हिज पैशन एंड दैट इंस्टिंक्ट, दैट एनर्जी वाज कमिंग आउट ऑफ हिम कि उसको कुछ तो मूवमेंट चाहिए है. सो वी
Hmm.
हैव टू कंसीडर दिस काइंड ऑफ ऑब्जर्वेशन also while treating the case. So I that was my strong point or strong characteristic and individualistic symptom for that child while I was prescribed the medicine.
Oh.
This kind of observation also we have to keep, how they behave, how they sit, why they are doing these repeated things.
Hmm.
And he got better, of course. But
Wow.
why I wanted to share this case, to just tell you that we have to be an observer all the time.
Hmm. Is
So
that is
these
the
are few case examples I wanted to, acute में कैसे होता है, autoimmune में कैसे होता है,
Hmm.
child में. So all age group from babies till jet.
Yeah, that's a wonderful case studies, Tanuja, which you have
Yes,
explained,
yes.
and definitely it can give everyone a complete insight, a complete understanding about the treatment regime which the homeopathy is taking care of the people. Just one more question I just want to ask you. I know that there is some time limitation, but one more question I just want to ask. When we are taking
No problem.
one type of medication, for example homeopathy, so are there any contraindications that I cannot take the other mode of treatment? When I'm taking other mode of treatment, so certainly I'm referring to the allopathy mode of treatment or the ayurveda mode of treatment. So will these medicines have some contraindications with other modes as well, or I can take everything simultaneously, or I do not need? How can I understand this?
Well, if you're taking allopathy for longer duration, and
Mhm.
if you want to opt to homeopathy, homeopathy complements it because the principle of homeopathy is completely different. It works on a different level. The medicines are non-toxic and dynamic medicine, which are not going to interfere with the allopathic medication. कि उनका कोई drug दोनों का आपस में कोई interaction होगा, no, because their action is different, and here the action is different, so it can complement each other. Allopathy, Ayurveda, it's better to take one uh, pathy at a time if you're taking a Ayurveda, because even they use a lot of crude drug substance.
Hmm.
So it's better to have that one pathy at a time. It's
Okay.
not to Ayurvedic bhi le rahe, homeopathy bhi le rahe.
Hmm.
And you can take acupuncture and other pathies, you can complement any energy healing you are doing, you can complement. Homeopathy, that's the best choice
Okay.
because there is no compensation, there is no alteration in your system, and your expression will be as it is.
Mhm.
To understand better way. But if you have to take, you can complement with homeopathy, of course.
Okay. So I believe everyone can understand in this way that allopathy can be combined with the homeopathy, but certainly the Ayurveda system of treatment, it should not be combined with the homeopathic mode of treatment. Yeah, that's a wonderful information, Tanuja. Okay, now coming to the last question of mine. I know I cannot end this conversation because this particular science of treatment is so interesting, And whatever treatment options you are telling to everyone that what are the different case studies wherein this treatment you can apply, and how holistic the nature this particular treatment regime is holding. That's really interesting and wonderful thing. But yes, I know I have to end this conversation, so I just want to understand, uh, do you read any kind of scientific literature? When I'm telling scientific means any kind of research studies are there wherein they support any kind of physiological pathways when the homeopathic medicine is being prescribed or is being taken by the patient? Are there any clinical trials for the homeopathic medicines as well? And how we can see the future of homeopathic medicines in the entire healthcare system, means the way the variety of diseases are increasing. So are there any new inventions in the homeopathic systems as well?
The research is going on in homeopathy every day, because you can see the efficacy of homeopathic medicine by its effect, the case studies. Lot of new medicines, lot of drug provings are happening, because homeopathic drug proving is done in multiple times. One medicine getting proved multiple times on different age of individual, different both the sexes. So it's the same kind of research, happens in homeopathy as well as in other conventional mode of system.
Okay.
So the new drugs nowadays, it started with few hundreds of the drug. Few years back, now it is 8,000 drugs which has been proved in homeopathic materia medica. So there is a research, studies are going on. So if you just go and see on Google, you will see a lot of research which is going on
Okay.
in journals. There are a lot of drug provings which are happening.
Mhm.
And what was your next question you asked me?
I was just asking the way the human lives are changing, the way the disease patterns are changing.
Yes,
Means
you are seeing that in
recently
COVID.
we have seen the COVID. So we do
COVID,
not
that
know
is
what's
what
gonna happen in the future. So how the homeopathic medicine?
exactly.
Yes,
But that was an eye opener in COVID. Everybody understood immunity. At least I'm so
exactly.
happy people started thinking about immunity. कि
Hmm.
immunity क्या है? क्योंकि सब बोल रहे immunity बढ़ाओ, but immunity
Yes.
कैसे बढ़ने लगी? उसके and now at least people are becoming aware about this कि immunity है तो immunity medicine चाहिए. Immunity सिर्फ physical नहीं होती है, mental होती है. You have to do exercises, yoga करना है, meditation करना है, mental well-being रखना है, physical अच्छा food खाना है. So a lot of mindset has have been changed.
Hmm.
And in future, I'll see now, there is, because of this, there is a lot of openness about homeopathy as well. Before, uh, I will not say कि just homeopathy rakho, and because every science has its own good points. Ultimate aim is to heal that person.
Hmm.
So the integrative approach is the best approach, where you accept all the science, take the best of each science, and give whatever is best for that person. So
Okay.
if it is required allopathy along with homeopathy, one
Hmm.
should be able to open for that. So that open mind is very much required, and now it is getting also. If you see lot of big, even the government hospitals and lot of, they have started incorporating the homeopathic OPDs along with the conventional OPDs, even in Pune, in Mumbai. So now that approach and that open mindset has been there, and now people are getting more aware about it, to accept this science, to know more about this science, and experience this. So there is a huge future, and I think um, it's going to help to heal the whole. If we have this approach, the integrative, holistic approach.
Wonderful, wonderful, Tanuja. And I can just understand that how does it feel when you are giving the healing to someone by using your knowledge, by using your education. Yes, it's all about implementation. So whatever you have learned, you are using.
Yes,
Yes,
I can't express it in words ki how I feel when I see those changes. I feel really grateful. I can say ki thank God I'm a homeopath, and I'm a chosen one to do this thing, and I'm glad I'm doing a bit of my part. this is what I feel, this is how the purpose should feel. So that is the only thing when I see this, it is not just my profession ki it is only for earning I'm doing it. It is something which is I really want to do it.
Hmm.
That belief system, there's something, so that grateful feeling is there, and then everything follows along with that.
I can understand. Even when you were sharing your case studies, I could feel that sparkling in your eyes. I could
Yes,
feel the
I
satisfaction.
I could see this expression of my patients when I'm sharing that with you. Yes.
So the same thing I was feeling, that how contented you are feeling when you are sharing your patients or your clients' case studies. I believe that's the greatest blessing we are having. और जो हमें बचपन से सिखाते हैं ना तनुजा कि डॉक्टर, जब अगर मैं उसको प्रॉपरली नरेट करूँ तो डॉक्टर को हम बोलते हैं डॉक्टर भगवान होता है. So that feeling, the people connect with the doctors irrespective of what mode of treatment you are giving. But whenever a patient is reaching to the
True.
doctor with that much hope, the patient is reaching
Hope.
that I would get the treatment. So you are blessed. You are
Very
a
true.
part of this journey, and you are giving that treatments to others. Really, you are a blessed person.
I am also feeling grateful for this. Always, always.
And thank you, Tanuja, for shedding बहुत मतलब that enormous amount of light which you have shared today regarding this important mode of treatment, so that people can understand it in a scientific manner. That's a beautiful aspect which you have
Right.
bring out about this important mode of treatment today. And one of the important aspect which you have shared today, that is the holistic aspect of the homeopathic treatment options. So really, I know I have taken a lot of your time today.
No, no, not really. I really enjoyed, having that conversation with you. And when you say it has to be, heart to heart, I wanted to talk about it. I wanted to talk about it. And I'm so glad through you, it might reach so many people and it will help so many people, after listening to this conversation, knowing about homeopathy. So everything about homeopathy is great. And
True,
its
true, true,
opportunity is
Tanuja.
great for me as
True,
well.
Tanuja. Yeah, thank you so much, Tanuja, for sparing your time.
Thank you so
Thank you.
much.